So each one of us has gone through episodes of extreme sadness and grief, and it's perfectly normal because it's not every day we wake up feeling happy. It's not every day our plans go as planned. Sometimes the plans are smooth sailing, sometimes nothing seems to be working. So it's perfectly okay to be sad. What is not okay is when that sadness prevents you from living your day-to-day life. It interferes with your daily activities. That could be a sign of depression. Hello everyone, welcome back to my channel. My name is Christine. I am glad you could make it here. So today we are covering the 9 types of depression, because most people do not know there are types of depression, or they know but they don't know there are quite a number. So if this is your kind of content, please hit the subscribe and the like button, because when you do so, it helps the algorithm and it helps my channel grow. The first type of depression is called major depression, also known as unipolar depression, classic depression, clinical depression, or major depressive disorder. Sometimes depression, any type of depression, does not, well, most types of depression do not have anything to do with what is happening around us. You could be having your dream job, you could be in the most loving relationship, you could be driving your dream car, you could be hopping from one plane to the next, going to exotic places, but you're just depressed. And that can be caused by chemical imbalances in our brains. So sometimes depression is not as a result of what is happening around us. So the major symptoms of major depressive disorder are lack of interest in normal activities like your hobbies, you the like something that used to give you joy, it's just there. You could be eating, okay, I know eating is not a hobby, but sometimes your most sometimes your favorite food just tastes bland. Sometimes you don't even want to have sex, and maybe it used to give you joy. Well, I know it gives you joy, it gives everyone joy at some point, so sometimes we don't want to have it. The other symptom is feelings of sadness, emptiness, hopelessness. You're tearful most of the times, and sometimes there's absolutely nothing making you want to cry. You get frustrated, or you get angry, you are irritable over the minutest things, you are anxious about things, you are restless. Sometimes you are slow thinking. You don't even want to think, you just don't want to do absolutely nothing. The other one is feelings of worthlessness. You are guilty, you keep on remembering all the wrong things that happened in the past. You have trouble thinking, you can't concentrate, you have trouble making decisions, you have thoughts of self-harm, you have suicidal thoughts, and in extreme cases someone just commits suicide. The second type of depression is called persistent depressive disorder, also known as chronic depression or dysthymia. And this type of depression is hard to diagnose or to detect. by yourself. That's what I mean. It's hard for you to know that you have depression because it's just like no more sadness on most days. And sometimes, especially if you are used to being sad, having gloomy feelings every now and then, it's really hard to know that you could be depressed or not. And this type of depression, as the name suggests, chronic depression, it's depression that lasts for more than 2 years, and most people can have it for over 10 years, or their lifetime. And as noted, dysthymia or persistent depressive disorder is it's not as serious as a major depressive disorder, but of course it makes living your day-to-day life a little hard, because sometimes you have problems waking up, you have problems finishing your tasks at work, or you know your day-to-day activities just become hard. And some of dysthymnia's symptoms are sadness, hopelessness, loss of interest in your day-to-day activities, things you used to love. You have problems concentrating, you have mild memory loss, your sleeping schedules changes, you have feelings of inadequate, you have feelings of inadequacies, you have feelings of worthlessness, you have self-esteem issues, you experience, or rather you are unable to experience joy in activities or in events or occasions where you're supposed to be joyful. So yeah, that is persistent depressive disorder. It's just like a major depressive disorder, other than less it's less serious. Okay, not less serious, but it does not make your life really hard. You are still able to do your daily activities, they just become a little hard to accomplish. The third type of depression is manic depression or bipolar disorder. And this type of depression is characterized with periods of hypomania, where you are very happy at some point and the next time you're severely depressed. Signs of a manic episode are you have high energy, you have reduced or you don't sleep at all, you have lots of racing thoughts or in your head, or you start talking fast, you have grandiose thinking, or you start making big plans, you have increased self-esteem or self-confidence. Is there something like self-confidence? You have feelings of euphoria. As I said, you are extremely happy, and these episodes can go for a week, and in severe cases one can experience delusions or hallucinations, where you sometimes you can taste, you can feel, you can see things happening to you that are not happening to you. I don't know if that makes sense. Like, you imagine things, they are so vivid, you can feel them, you can see them, you can taste them. That is one major symptom of bipolar disorder or manic depression. And there are 5 types of bipolar, but we are going to talk about them in the coming videos. The 4th type of depression is called depressive psychosis. These this type of depression is characterized by hallucinations and delusions. It's just like bipolar disorder, but this is mostly characterized by delusions and hallucinations. Hallucinations, as I had said earlier, is when you can see, you can feel, you can smell, you can taste things that are not really there. A good example is when someone can see or can hear voices that no other person around them is able to see or hear them. And sometimes such a person is not able to sit still because they can hear voices, and of course there are voices that are scary to them, so it's hard for them to sit without moving. The 5th type of depression is called seasonal depression or situational affective disorder, or major depressive disorder with seasonal patterns. This is depression that happens, or rather occurs during the cold seasons, like during the winter or fall seasons, for those who are not in the tropics like us. So for people in the tropics, it could start when it starts raining, March, April, May. Become serious when the cold sets in, like during June, July, August, and it could be what I'm experiencing right now, because I'm low-key miserable. Like I'm having trouble waking up. I just want to sleep all the time. I have gained some weight, although I don't know whether it's hormones acting up. Anyway, the common symptoms of seasonal depression are social withdrawal. You just don't want to associate with people, talk, texts, whatever. You just want to be left alone. You have increased need for sleep. You gain weight. You have feelings of sadness, hopelessness, unworthiness. You're just low-key depressed. Like, you just look forward to going back home in the evening. On days you have to go to work, you really drag yourself because you really don't even want to wake up in the first place. During the day, you just wish you could go back home and sleep. As in, right now I'm just living for weekends where I can just be lazy and do nothing. Anyway, those are the 5 types of depression. We are going to cover the remaining 4 in our next video. So see you around. I hope you have learned something, and don't forget to subscribe, to share, and to comment, and to tell a friend. See you in my next video. Bye.